aspire to be superstars in orthopedics. So stick on to your seats for the next 15 minutes. I'll sail you through the pillars of healthcare success formula that are essential as points to reach to the next level of trajectory. You know, I was a person associated with established corporate healthcare on big positions, and I always had a misbelief I had enough knowledge of sales and marketing portfolio living in a corporate healthcare world. Till the time I moved myself to courses with Kellogg University in US, and the misbelief told me that whatever they told as obsolete, waterfall marketing is the same thing, so I was always very confident about. So the world, do we have this? Yeah. So the world has moved on from this conventional methods of capturing your patients to the newer methods called as agile marketing systems. So this is what we will touch base. What are the newer methods? What we can imbibe in our practice? Your healthcare practice is like a bucket with a lot of holes. You carry a lot of band-aids to keep sealing it. And that's what is very important if you want to the niche to the next level. So today it's a highly competitive environment. More and more people jumping in, corporates having 6 units, 7 units. So healthcare becoming most cost viable, your healthcare manager coming to you and talking about the ROI and the P&L sheets. So you're threatened by today's forces. So how you position yourself in today's armamentarium is going to be extremely important. So now you play multiple roles as a juggler, as a CEO, as a sales marketing expert, academician, financial expert, family expert, and definitely as a surgeon also. So it's like juggling multiple hats to reach on. I always use this word. Sometimes it's not about who has more talent. It's basically who's more hungrier. So your hunger will drive to take to the next level. Everybody sells by selling something. We say your patients is your practice. Rest all is just paperwork. So you should know what you are going to be plugging onto your patient. How do you fit into his patient journey? When I discuss, 95% of my colleagues really do not know what is advertising, what is branding, what is marketing, what is sales. So what do I talk about the next? So branding is a premix, but marketing is something like you nurture a patient, it's like building on the base. And the bullseye is sales who goes and converts. So when you have to start your practice, a lot of you move on from government hospitals to the defense guys or whatever, you have to understand what is my target audience, where do I start from, what is the kind of gender, what is the paying capacity, what is the strata of population. So this is strategy, which is extremely important once you're planning to build up. So where you are, where you want to be, and I always talk about as a vision, mission statement. Your goal set has to be very clear. What is your target audience? What substructure like orthopedics, arthroplasty, subspecialty in orthoplasty that I want to build on? What is my target audience? What niche area do I build on? So where to start is extremely important, that where is your target audience? What is the paying capacity of that audience? Selecting a location is as good as choosing a spouse for a long-term relationship. Your demographic area is extremely important. Your understanding of that market areas. Like Jawad spoke about, here we have 80% knees and Greece would have 80% hips. So it is very important you do something which is in sync with the market strategy. Now, moving on for strategy, the next part is branding. How do you brand yourself? How do you become a successful brand in healthcare? So branding is developing virality around you, developing a sort of a confidence around you. So how do you become a successful brand? What are the levers you need to have to create that virality is extremely important. And that's where you have to resonate with the patient psyche, with the patient thought process. Your brand is what others say when you are not there in the room. Brand is not just logo. Brand is something that builds you an equity. Like Vijay, my friend in hip, is like a Starbucks, who can charge 10 times the volume because Vijay is what Vijay is. So brand gives you differentiation. It is an ongoing process, not just a positioning. So as I told you, brand gives you a value proposition. And this is what people speak about you when you're not in the room. You create an ecosystem around you. Brand is a perception, and perception will become reality over the span of time. This is what experts feel about brands. We know about a lot of healthcare brands which are pretty established. It's again, building. They know they will have the best infrastructure, the best kind of a competence. So when you become a brand, what is their USP? What is your unique selling proposition? How do you differentiate from others? What is different that you bring onto the table? Pure talent or education is not what takes you to that level. People have to have a confidence. What you deliver as an endpoint is gonna be best and sustainability-wise also the best. So you are the center stage. I always say when a clown enters the palace, he doesn't become the king, the palace becomes a circus. So it's very important that you are the center stage. You know what you're going to bring across rather than just positioning. Positioning is one perspective of it. Talent, infrastructure is the next important part. People envisage you with an infrastructure. This is Oberoi's. What is it? Sustainability of infrastructure. If it is Tata Memorial, it has to be education. So you never get a second chance to build up. So your infrastructure has to be very clean. Today, a mix of hospitality is getting into healthcare. So your infrastructure has to be, a healing environment, as they always say, with everything. Nobody wants to waste time. Your appointment system, to the apps, to whatever you can do, so that your ecosystem goes along with what you want to position yourself as want to be. A professional outlook at your clinic. I saw Anil's team carrying on, Dr. Anil's team. It is a positioning. It is something that I am there to assist you when you are there in this system. And you are the center stage. You define the rules to the game. So when you are the center stage, everything moves around. If you have something exclusive and very different, you can position for the patient that builds in credibility across it. You are an expert in that particular domain. Your experience of your patients about you or about your organization also bends across what is the kind of experience others had in the past about this. So talking of technology integration now, it's a movement of technology. You see new hospitals getting in. They're integrating a lot of things in healthcare, telemedicine, AI, augmented reality, virtual reality for teaching, how your counseling has to happen off. So what you saw as a previous Gurva's team presenting on was what technology is going to get across. It's becoming more understandable, more relatable. People also want something that can relate with their problem, something that can relate on the visuals across that they have in mind. And as they say, your videos today are worth a million pictures. So marketing is where a rubber meets the road. And marketing is like understanding the needs of the consumer and plugging those things. What does the consumer want today if he has to make a decision? Can you plug all those points? Can you fill all those points? And your patient, your consumer is somewhere in this sales and marketing funnel. You have to identify his problem. That's the way he allows you to grab him and bring you under his knife. So today the world is moving to 360 degrees marketing, not only the traditional, but digital. And it's like we have a multimodal pain control. It is like a multimodal process where all the levers have to be invited. But whatever we go on to the new concept, the age-old thing remains is the word of mouth marketing is one of the best. How your patients feel about you is the most important part that you can never ignore or sacrifice. Talking of this management mantras of ATL, BTL, above the line marketing, below the line marketing, through the line. Above the line is non-structured, like Amazon comes on the TV, on the flash, on the radio, on billboards, very low ROI. Structured part is telemarketing. Through the line is like digital, which is way more better ROI, integrated process, and also has more cookie-based and pay-per-click marketing parameters. So it's a very different detailed world altogether. We'll touch base a few selective points. So traditional marketing was always very unstructured. You put up an ad in the newspaper, your target audience is not even 2% of that. It's a waste of finances. But for big brands, it creates a brand awareness. So creating a buzz on technologies. We have been listening all this while since morning on the newer technologies, newer parameters coming in. What are the new technologies that you can amalgamate as far as for the patient benefit? You're positioning into the magazines, in the new articles, so on the different platforms or profiling across in papers that helps you build a credibility profiling on what you're doing and how you're benefiting the society. So digital marketing. They say that if you are not there on the digital media in the today's time, you do not exist at all. So that's the in thing. So the first thing in digital is to build a responsive website which is mobile friendly, which is fast, which has reliable, readable content. In this jungle of information available on the internet, how you relate useful information for a consumer which is pristine, not copied, no plagiarism. So SEOs help you utilize that. So many times when people talk about digital, see, just posting on social media is not digital marketing. It is just like throwing spaghetti on the wall and thinking it is going to be sticking. So today just posting, I post things across on social media, that's not digital marketing. You need to be there on Google search. In all established cities, people go on to Google to check on your credibility score, your reliability score. And social media platforms today relate a lot. Like Facebook would go on to the elderly population, for a younger population to more like a Insta and a Twitter platforms. So the role of digital marketing, which is more of cookie based, which is more like AI integrated into it, understanding what are your needs, what you are surveying, they will translate you to those platforms so as to think what the patient is thinking, they will think you cross to the same platforms. Today, the new things are like lookalike audience and remarketing of the tools. There are a lot of platforms today which help you out. So digital presence through the social media platforms, where it gives you a robust online presence and spectacular online reputation. These things are very important. You have combined platform. Google owns YouTube, so search engine is common. Facebook and Instagram are Meta, so there is a common platform. So these small tips are very important. There are new things like tele-CRM, chatbot. There are things like WhatsApp API, where you can do a focus stuff on some newer technologies or parameters that you are bringing across. So all these kind of technologies have their own sway, have their own kind of parameters, and the newer platforms in established healthcare, they're moving on to the CRMs and the QR codes and the link trees and the chatbots and how people connect with you on the PAPs and the riders. So the most important meat what people want to know is how, not how you present, is basically what kind of useful, relatable content you bring across. And when I say the content, videos on YouTube or whatever, make sure the formula is very simple. 80% education, maybe 20% promotion. So education is the most important part. How do you bring across reliable content, well designed for a consumer to understand what information you want to give it to them, so that it resonates with the need of the consumer, which is the patient here. Your blogs, your podcasts, everything is a newer platform that helps you resonate that. Today, video testimonials, your infographics, everything relates to the same arenas. Now, in this time, which is hugely competitive, I'm very glad to see in Delhi, the DA and other platforms going in. The world is moving towards collaborations. We don't want to compete against each other. We want to collaborate. And the collaborate parameters is connections. Orthopedic surgeons with urologists or transplant surgeons was initially. Now it is arthroplasty with arthroscopy surgeons, a hip surgeon with a knee surgeon. So different networking systems and collaborations are extremely important because it helps you unify the cost, it helps you have a common platform for your patients to sync up with. So today in the new arena, the networking is not just the GPs, networking is your fellow colleagues, networking is maybe 5 arthroplasty surgeons getting together and cohesively building their practice across. It helps you resonate and helps you decrease the cost. So you have to ask the reviews from your patients how they feel about you, because a lot of educated patient, if not the patient, his next progeny will check into your reviews how people feel about you. Hiring the right kind of talent is an extreme art. I'm extremely particular. When I look at loyalty, I look at compassion, I look at competence. We have volumes, we can teach them anything, but if they do not have these 3 things, they are not worth it. If you are Akbar in this story, where is your Birbal? So very important, your team has to have the same positivity profiling or a thought process as you are. So building teams looks simpler, but it's not that simple, because you are the driving force. The way you build your teams, like a Tata or any established organization, Apple, it's basically a very important part, how and the kind of people you hire and the power of the teamwork. Teamwork is extremely important. If you're not, it doesn't make sense to hire smart people and tell them what to do. They feel that we hire smart people so they can tell us what to do. You don't be a control freak. Let your teams give inputs. That will always be extremely helpful, giving them a space. So from this, it is the next is, as we are staying updated. That's the only way. The only thing which is a mantra for success is adaptability to change. What worked for you as the best, as a forerunner, might be the stumbling block for you for future. So you have to stay updated with times and you will stay ahead of the curve. They say if you do what you studied, you survive. If you do what you did not study, you succeed. So you always need to be ready, adaptable to the changes, because things are going to change. And what is good, what is not good. So as just like an app which requires an update, you are also an app which requires to be updated with time on the technology in different platforms. It is not just to be up to date, it is up to tomorrow. You need to be future friendly also. So in this, it is not a story of just perfection. It is striving for continuous improvement in your endpoints, both as a talented surgeon and as a leader, as a team leader that you go through as an overall personality, because it is not just how you make, a monkey can learn how to make an 8 cuts and do it. The golden rule is do not criticize others, comply with the medical and ethical guidelines, do not post things which are practical, do not post things which are wrong and a wrong information. We saw a lot of things when robotics came in, it will never have bleed and all those things, don't rubbish information. Today this is a story of brand stories. People resonate with the process, you need to be connecting with them. And they always say, repetition makes reputation and reputation makes patients. So it is just like jahan bhi jayega hame hi payega. So if you look at big brands, it is like creating a whole 360 ecosystem around you. And this is my mantra, as I always say. In today's competitive healthcare environment, effective branding can differentiate your practice and establish a reputation of trust and excellence. You need to be different. It's nothing different. You need to be different. And this is what is my quote that I go to, that I say, winners are not people who never fail. They are people who never quit. So whenever you're trying to sell information, you have to sell marketing in a structured and scientific way, you will find people criticizing you because they do not understand the process. So you don't have to worry about the trollers and the haters if you are rightful in your part, if you're ethical in your process, if you give the right kind of ethical information to the consumer, you're going to rise up like a phoenix from the ashes. So I wish the best. You be the rock stars in orthopedics for times to come. Thank you.